This course explores essential techniques, strategies, and tools that healthcare professionals can use to effectively communicate with patients who are hearing or speech impaired, ensuring patient dignity, understanding, and high-quality care. Let's begin with an introduction to hearing and speech impairments. We start with the types of hearing impairment. The first is conductive hearing loss, which occurs due to blockages or damage in the outer or middle ear, often from ear infections or earwax buildup. Next is sensorineural hearing loss, caused by damage to the inner ear or auditory nerve. Common examples include age-related hearing loss or hearing loss due to prolonged noise exposure. There is also mixed hearing loss, a combination of both conductive and sensorineural types. And finally, deafness represents total or profound hearing loss, which may be present at birth, called congenital, or acquired later in life. Now let's move to the types of speech impairment. Aphasia is the loss or impairment of communication abilities due to brain injury, such as a stroke. Dysarthria occurs when muscle weakness or paralysis affects speech articulation, often associated with conditions like Parkinson's disease. And apraxia of speech is the difficulty in planning and coordinating the movements required for speaking. Both hearing and speech impairments significantly affect a person's ability to understand spoken words, express themselves clearly, and engage in social interaction. Beyond communication, the emotional and social effects can be profound. People may experience frustration, isolation, or lowered self-esteem, making it essential for caregivers to respond with patience, empathy, and sensitivity. In summary, understanding the different types of hearing and speech impairments, along with their impact on communication and emotional well-being, equips caregivers to provide more compassionate and effective support. Effective communication with hearing speech-impaired patients goes beyond simply adjusting how we speak. This module explores verbal and nonverbal communication techniques tailored for these patients. Let's begin with verbal communication techniques. First is speech clarity. Speak slowly and clearly. Avoid shouting, as it does not improve understanding and may actually distort sound. Next, use simple language. Keep sentences short and concise and avoid medical jargon, so the message is easier to understand. We also rely on visual cues. Always speak face-to-face and maintain eye contact, which is especially helpful for patients who depend on lip reading. Finally, pay attention to your tone of voice. A calm, reassuring tone communicates compassion and helps reduce patient anxiety. Now, let's move to nonverbal communication techniques. Start with body language. Maintain an open and welcoming posture, and use natural hand gestures to enhance understanding while avoiding overuse. Next, focus on facial expressions. Expressions can convey emotion and add clarity to the message, so it's important to remain mindful of what you show. Simple gestures, such as nodding or signaling, can also reinforce verbal messages, especially when giving basic instructions. And finally, consider sign language. Learning even a few basic signs can make a big difference when communicating with patients who use it. In summary, effective communication with hearing and speech-impaired patients blends clear verbal techniques with thoughtful nonverbal cues, ensuring that care remains inclusive, respectful, and patient-centered. Not all patients with hearing or speech impairments can rely on spoken language. In this module, learners will explore various alternative communication methods to facilitate effective interaction. Sign language, American Sign Language or ASL, is the primary language used by many members of the deaf community. While CNAs do not need to be fluent, learning the basics, such as the alphabet and common phrases, can make interactions smoother and more respectful. In some regions, patients may rely on other variations, like British Sign Language, so it's important to be mindful of local norms. Pen and paper. Sometimes, the simplest tools are the most effective. Providing patients with pen and paper allows them to write messages directly, making communication quick and clear. Digital devices. Smartphones and tablets can also bridge the gap. Patients may prefer to type their messages, especially if writing by hand is difficult. Picture boards and communication cards. For individuals who cannot speak or write, picture boards and communication cards offer an easy alternative. These tools allow patients to point to symbols, pictures, or words to express their needs. Text telephones, or TTY devices. When phone communication is necessary, text telephones can be used. These devices convert typed messages into voice for the listener, and spoken words back into text for the patient. By recognizing and using these alternative methods, CNAs can ensure every patient has a voice, regardless of their ability to speak or hear. Technology plays a vital role in helping those with hearing or speech impairments communicate effectively. This module explores the tools that can enhance patient care. Hearing aids. Hearing aids are small electronic devices that amplify sound for individuals with hearing loss. As a CNA, your role is to adjust to the patient's needs. Make sure devices are working properly, batteries are charged, and that the patient is comfortable using them. Cochlear implants. Cochlear implants are electronic devices that provide a sense of sound to those who are profoundly deaf. CNAs should assist with routine maintenance but always follow nursing guidelines for their care to avoid damage or misuse. Speech-generating devices, SGDs. These devices allow people with speech impairments to produce spoken words using text or symbols. They come in different forms, such as tablet-based systems, dedicated devices, or smartphone apps designed specifically for communication. Video relay services, VRS. Video relay services make it possible for deaf and hearing individuals to communicate through video phones and sign language interpreters. As a CNA, understanding this service ensures you can support patients who use it to stay connected. In summary, assistive technology, from hearing aids to speech-generating devices, empowers patients to connect and communicate more effectively. As a CNA, your support in maintaining and encouraging the use of these tools can make a powerful difference in patient care. Listening is an essential component of communication. This module explores specific techniques CNAs can use to be active and empathetic listeners when working with hearing or speech-impaired patients. First, let's talk about active listening. This means focusing fully on the patient's message, showing genuine interest, and making sure they feel understood. You can use simple verbal affirmations like "I understand" or "please continue" to encourage them. Most importantly, avoid interrupting. Gives patients the time and space they need to express themselves fully. Now, moving to observing nonverbal cues. Sometimes, communication is more than words. Watch carefully for signs of frustration, confusion, or even anxiety that could signal miscommunication. Pay close attention to body language and facial expressions. By responding appropriately, you can reassure the patient and keep communication clear and calm. Finally, let's look at clarifying and paraphrasing. To make sure you've understood the patient correctly, repeat their message back in your own words. This not only confirms understanding, but also builds trust. You can also ask open-ended questions when needed, or even use visual aids to clarify complex points. In conclusion, being an effective listener means combining active listening, observation, and clarification. These skills help ensure patients feel heard, respected, and supported in every interaction. It's essential to communicate with respect and cultural sensitivity when interacting with hearing or speech-impaired patients. One important principle is respecting autonomy. Always allow patients to communicate in the way that feels most comfortable for them. And remember, not being able to hear or speak does not mean that a patient cannot communicate. Avoid assumptions and instead empower their choices. Next, let's talk about cultural sensitivity. Keep in mind that different cultures may have unique perspectives on disability and communication. Be mindful of social norms and customs, especially when using sign language or written communication. This ensures that your care remains inclusive and respectful. Finally, let's look at respectful etiquette. When working with an interpreter or using sign language, it's important to direct your attention to the patient, not the interpreter. Maintain eye contact with the patient even when assistive tools are involved. This demonstrates respect and keeps the interaction patient-centered. In short, cultural sensitivity means respecting autonomy, recognizing cultural differences, and practicing proper etiquette. By combining these practices, CNAs can foster trust and deliver care that truly honors the dignity of every patient. Misunderstandings are common when communicating with hearing or speech-impaired patients. This module explores common challenges and strategies to overcome them. First, consider the environment. Reduce background noise whenever possible so the patient can focus on the conversation. Make sure the room is well lit to support lip reading and visual cues. Next, be aware of cognitive barriers. Some patients with speech impairments may also have cognitive difficulties. Always be patient and give them the extra time they need to respond. Finally, use feedback and clarification to ensure accurate communication. Repeat back what you believe the patient has said and confirm with them. Encourage questions so misunderstandings can be addressed quickly. By staying mindful of these barriers and applying these strategies, you can create clear, respectful, and effective communication with your patients. In this final module, CNAs will learn practical approaches for supporting patients with hearing or speech impairments during daily care tasks. Let's begin with personal care tasks. It's important to assist with bathing, dressing, and other activities of daily living while always making sure the patient feels heard, respected, and involved in their own care. Moving on to medication management. Clear communication is critical here. Use written instructions, visual aids like pictures or even digital devices to help patients fully understand their medication regimen. This reduces risks and builds confidence. Next, we focus on mobility and emotional support. CNAs play a vital role in helping patients maintain independence. At the same time, you should provide reassurance and address emotional concerns such as distress or social isolation, which are common in patients with communication challenges. In summary, by combining patience, creativity, and empathy, CNAs can ensure that patients with hearing or speech impairments receive not only excellent care, but also respect and emotional support in their daily lives. Effective communication with hearing and speech-impaired patients requires patience, understanding, and the use of a variety of methods and tools. By using the strategies learned in this course, CNAs can provide dignified, compassionate care while ensuring that communication barriers do not interfere with patient well-being.